the maybe giving you a philosophical question. I'm curious, what do you think is the future of imagery services, and maybe more specific, um, lung and CT chest analysis? I mean, and what do you see that people don't?
So, I think that at VITA, we've always looked at to really be able to solve a case for AI and to make a clinical impact. You have to have an in-depth understanding of that clinical problem that you're solving. So that's why. So there's a lot of opportunity for AI, and there's a shortage of physicians. There's physicians spending their time on things that is more conducive to computation. So I think that is all a component of the value proposition. But to really be able to solve these clinical problems, you have to have a understanding of the depth of the clinical issues, a depth of understanding of the disease state and the comorbidities associated with that disease. And then you can apply AI you can apply data science and intelligence to a clinical problem, and not have data science sort of back end try to say, okay, you're going to use this tool, to solve this clinical problem. And I think that's a difference in approach. So I think that's, fundamental to all of AI. I think the other component of this is that it has to be integrated into a clinical workflow, and it has the ability certainly to enhance clinical workflow in its use case. So it's better information, it's a more informed process, but it streamlines care coordination and it drives efficiencies. You can use information in ways that can be in lieu of a more expensive test, in lieu of a more expensive procedure. You can use information to determine whether or not they should be getting that procedure at all, whether or not they should be getting that asthma drug at all. That's the information that AI can provide.